Good evening. Now we are going to talk about the second topic, which is semiotic of the hereditary diseases. First of all, what is semiotic? Semiotic means the study of the signs and symptoms of the diseases in this criteria. So it is in the normogenic state. We have two classes of the genetic diseases, which are simple genetic and complex genetic. As we discussed earlier, the simple genetic are the traits which can be followed up throughout your genetic predisposition, and it follows Mendelian disorder and the reason or the causative agent is known. Whereas in complex, it's an unknown etiology, and environmental and genetic factors are both associated in this criteria. The genetic disorders are classified into multifactorial, single gene, chromosomal, mitochondrial, and somatic mutations. So, what is its syndromological diagnosis? So, hereditary disorders are caused by the change in genotype mutations, resulting in either failure of embryogenic development or disturbance in certain link of metabolism. In different people, certain hereditary disorders usually manifest with same clinical feature. As a result, many factors are involved in these criteria, but defined complex of these symptoms are the patterns of the same pathology which can be seen throughout the syndrome. Knowing the pattern of the syndrome of the certain hereditary diseases, one may diagnose the disease on the basis of phenotype analysis or genotype analysis. So the diagnosis of the majority of hereditary diseases are syndromological. Many of the hereditary syndromes are diagnosed only on the basis of characteristic external feature criteria in the phenotypic hereditary inheritance. In many of the cases, potential diagnosis is carried out by special criteria of symptoms such as visual aid to diagnosis and computer tomographic diagnosis, which are used on a program basis. So the description of the patient phenocopy is mostly not enough. Exact diagnosis is very important. So the prognosis is viable. Choosing the treatment and calculating the recurrent risk. For example, a patient with Patau syndrome, there is no sense of performing surgical correction of the cleft lip because the syndrome is lethal. Arteria of the esophagus may be isolated, congenital defects, or syndrome of lethal Digeorge syndrome. In first case, surgical treatment is indicated. In the second case, it is out of the sense aspect for it. Exact diagnosis allows to determine the mode of inheritance, and this is exactly necessary to calculate the risk factors and choose the parental diagnosis method. These term syndromes is clinical, genetic, often used as a syndrome for word diseases. One may say Down syndrome, Patau disease, and Down syndrome, Patau syndrome. For many hereditary diseases, term syndrome traditionally is used for more often, such as Klinefelter syndrome, Turner syndrome, Russell-Silver syndrome, and Cornell D. Lake syndrome, and so as followed on. What are the features of the genetic diagnosis and these criteria? So we have diagnostic as in genetic disorders of sickle cell and diseases. We have cystic fibrosis and cystic fibrosis liver diseases. We have brain, nerve, spine, and Huntington diseases, and cleft palate and Patau, cleft lip and Patau syndromes. And how do we diagnose this? Laboratory tests includes genetic testing, molecular chromosomal and biochemical genetic or genomic testing are used to diagnose genetic disorder. Other laboratory tests that measure the level of certain substances in the blood and urine can also help in the suggesting the diagnosis. So, what is monogenic diseases? In human genome, it is established that around 25,000 to 20,000 genes that serve the blueprint for building all our protein. In single gene disease, a mutation in just one of these genes is responsible for the disease to occur. The single gene diseases run in a family and can be dominant or recessive. An autosomal or sex-linked pedigree analysis of the large family with many affected members are very useful to determine the mode of inheritance and the pattern of single gene diseases. So it states that you need to find out through the pedigree analysis of a family history to analyze the same defect in same gene which have been occurring throughout the uh, genetic history. Here we have some diseases, their mode of inheritance, and gene response. We have phenylketonuria, which is known to be autosomal recessive, which is caused by phenylalanine hydroxylase. We have cystic fibrosis, which is also autosomal recessive, which is cystic fibrosis conductant transmembrane regulator, CFTR known as. We have sickle cell anemia, which is also autosomal recessive, caused because of the beta hemoglobin. We have albinism, which is also autosomal recessive, which is caused because of oculocutaneous albinism to OCA2. We have some autosomal dominant diseases such as Huntington diseases, which is caused because of the Huntington and dysphosphate mitochondrial protein kinase. We have hypercholesterolemia type B, which is low density lipoprotein reactive receptor related problem. It is also related to alloprotein B. We have neurofibromatosis type 1, which is caused because of the neurofibrinogen 1. We have some X-linked and Y-linked recessive diseases such as muscular dystrophy caused because of the coagulating factor uh, dystrophin. We have Rett syndrome caused because of the methyl CpG binding protein 2, and so on. We have epigenetic control over this. The epigenetic control of the gene expression program is essential for normal organism development and cellular function. For epigenetic regulation is seen in many human diseases, including cancer and neurofibrtic diseases, which can be affecting the etiology and progression in the abnormal epigastric proliferation can serve as a biomarker for disease. Predicament of these diseases and their outcome depend on the clinical investigation of the diagnosis, their prognosis, and treatment. In this, we review that we can overall achieve the epigastrial mechanism of human disease, their genetic mutation in the endocord chromatin regulation, and can cause monogenetic diseases or it can be polygenetic, multifactorial, or environmental based. Some of the environmental stresses can also be impact directly on the chromatin regulation and cause in the increase of risk directly upon the genetic mutation factors. Emerging evidence suggests that the exposure to the environmental stress in the older generation may predispose them to subsequent generation of the diseases in manner to involve transgenerational inheritance of epigenetic information. Here we can see the inborn metabolic diseases. Inborn metabolic error comprises of large group of genetic disorder involving disease of metabolism. These refers to the congenital metabolic disorder. So, what are the major categories of inheriting metabolic diseases? These are divided into carbohydrate metabolism, for example, glycogen storage diseases, amino acid metabolism, such as maple syrup urine diseases or phenylketonuria. We have organic aciduria. For example, we have alkaptonuria in this disorder of fatty acid oxidation mitochondrial metabolism. We have examples such as glutamic acid type 2. We also have disorders of porphyrin metabolism. For example, acute intermittent porphyria. We have purine or pyrimidine metabolism, such as Leishman-Pack disease syndrome. We have mitochondrial function. We have Karen-Sachs syndrome. We have peroxisomal function diseases disorders, which is Zollinger syndrome. We have liposomal storage disorder. We have Gaucher syndromes. So, what do we check in the laboratory studies for an infant suspecting of having an error? So, we check for the complete blood count, its differentials. We have urine analysis. We have blood gases. We have serum electrolyte, blood glucose, plasma ammonia. We have plasmin lactate. We have urine organic acid, plasma and urine amino acids. Their quantitative numbers are being checked during the laboratory analysis. And what are the mostly useful studies from them? For example, we have galactosaminuria, substance RBC, galactose phosphate uraldase transferase can be seen. For hereditary trisemia, plasma quantity amino acid, urine succinylcholine A1 deficiency, quantitative serum A1 atropines protein inhibition typing, neonatal hemochromatosis, serum ferritin for the liver biopsy test, Zillinger syndrome plasma with a long chain of fatty acid. We have Niebeck diseases type C skin biopsy for fibroblastic culture. We have GSD type 4 liver biopsy for histology and biochemical analysis of skin biopsy with assay. How do you treat the inborn error of metabolism? So the management of inborn error of metabolism has traditionally consisted of diet therapy and suppository therapy. But recently, the other treatment opinions have become available, including enzyme and coenzyme replacement, removal of harmful substances, cell and organ transplant, and gene therapy available. Here are some examples of route of chemistry in the blood of plasma. So it's composed of glucose. We have disorders and their source. We have glucose, their disorder and source. Ammonia, which are the disorders and their sources. We have blood gases, disorders and their sources. We have few more. They can depend on acidosis cases. We have alkalosis cases, and we have lactate or pyruvate. Their diseases, disorders related to their sources. We have creatinine related to their sources. We have urea when it's increased and when it's decreased. Hyper or hypo. Uric acid in hyper cases and hypo cases, which are related to these cases. Thank you.